Hi, in this video, we'll be debunking the myth about cancer being an emergency. As a surgical oncologist, whenever I see a new patient, they're always worried that they have a cancer and it is an emergency. Now, in reality, is it an emergency? Cancer is a chronic disease. It takes years to happen and develop. Some of them have such a long history, like cervical cancer, which takes more than 10 years to develop. Similarly, colorectal cancers, which take about 10 to 15 years to develop, and finally end up in cancer. And none of these cancers are an emergency as a patient imagines. There is always time to think and make a proper plan around treatment before any form of treatment is started. Cancer does not spread in days, it takes time to spread. If you make a wrong decision or make a wrong treatment plan, it can be very, very bad in the long term outcomes. So, whenever we plan any treatment for cancer, we sit with all the evidence that is there about the disease and then put a flow chart as to what should happen after what. And that is when the treatment really starts. Having said that, there are some emergencies in cancer. In fact, I would count two most important emergencies. One is an obstruction and the other bleeding. Obstruction is an obstruction for the airway, like difficulty in breathing, or an obstruction to the bowel, like there is a growth in the intestine which causes a blockage of the intestine. And such kind of situations are a true emergency and they require surgery. Per se, if it is a cancer without any obstruction or any bleeding, it is not an emergency. It is a very, very elective procedure which requires a proper planning and execution. I'll give an example. Say you are going from your house to the airport and you have to hurry because you have lost a lot of time, you are starting late. What do? Do you go out and catch the first bus that comes? I don't think you can do that. You have to catch the right bus whether you are in a hurry or not. Otherwise, you'll end up reaching a wrong destination. So, the idea of the treatment or planning the treatment is all about doing a correct choice. You have to get to a correct line of treatment before you can execute the plan. So, it is all about planning and execution of the plan once it is made. Thank you.